legislature directed the Washington State Auditor's Office to do a performance review of the exchange's operating costs. We were specifically directed to look for opportunities to reduce operating costs, including partnering with the federal exchange and other states.
We looked at the exchange's operating costs, specifically its three largest areas of costs: the call center, payroll, and IT maintenance and operations. We also looked at some of its long-term financial sustainability practices, which also led us to look at its reimbursements for Medicaid-related services, which actually led us to one of our more significant observations. What we found is that the exchange is not being fully reimbursed for the costs of services it provides for Medicaid customers. What we found is that the agreement that the exchange developed with the Healthcare Authority and that is approved by the Centers for Medicare and Medicaid Services does not fully capture all of the costs related to providing services to Medicaid customers.
We looked at the three largest categories of costs. We looked at IT maintenance and operations, we looked at payroll, and we also looked at the call center. We compared these cost categories against national benchmarks and also other state exchanges, and we determined that yes, they are reasonable in comparison. So for example, with the call center, the hourly rate that the exchange pays to its call center provider is reasonable in comparison to other states. Also, when we compare the amount that Washington paid for its call center, it paid a similar amount as Maryland and Kentucky that handled over 3 times the enrollment-related activity. The exchange has taken a number of steps to reduce operating costs. There are steps that it could continue to take. For example, to reduce call center costs, the exchange could explore a partnership with Covered California. Both exchanges use the same call center vendor. However, Covered California is paying a lower hourly rate. The exchange could also potentially reduce operating costs by exploring further partnerships with the broker community.
We did look at whether it would be cost-effective for Washington to lease the federal IT platform, healthcare.gov. We found that the federal government is implementing a user fee to lease the IT platform, and the cost of this user fee would exceed the benefits of reduced costs for IT maintenance and operations. So we found that while it's not currently cost effective, it would be beneficial to routinely assess whether there would be a benefit in leasing the platform, especially if the federal platform gets more efficient and the costs go down. We recommend the Health Benefit Exchange work with the Healthcare Authority to ensure the exchange is fully reimbursed for all Medicaid services it provides, continue to reduce call center costs, continue taking steps likely to increase enrollment and resulting revenues, and improve its long-term financial planning. As part of the appropriation process, we recommend the legislature consider the exchange's need to obtain full reimbursement for all Medicaid-related costs and planned IT investments, the need for both working and capital reserves, and how transferring those reserves adversely affects planning.